there's just as much evidence that eating 6 hot dogs a day can help prevent or cure coronavirus. I'm a huge proponent of cannabinoids, but I'm a huger proponent of not making false claims that will mislead people.
Hi everybody and welcome to Different Leaf, the podcast. I'm Brit Smith and I am getting really used to this home studio. I'm starting to dip into my emergency bud supply as I head into day 30-something of lockdown, so I hope everyone out there is hanging in there okay. On this episode, our first to cover 420, I'm talking to Harvard physician and cannabis specialist Dr. Peter Grinspoon. Now that name might ring a bell with you. You may have even smoked a strain called Dr. Grinspoon, which is actually the namesake strain of Peter's father. You can read more about him in the first issue of Different Leaf magazine on page 41, Dr. Lester Grinspoon. Peter is not just a medical doctor and a marijuana advocate, he's also the author of the book Free Refills, A Doctor Confronts His Addiction. Last time Peter and I spoke on a podcast, we were discussing our shared histories of addiction and how cannabis played a role in my recovery. This time, we're going to be talking about how cannabis is being treated in this weird new world of the coronavirus pandemic. Just a side note, we did record this episode at the end of March, and obviously things have been changing pretty rapidly every day since then. So at the end of the interview, you can hear all the most current cannabis-related news in New England.
So the last time that we talked, we were talking about our addictions, and I thought that might be kind of a good place to start today. How are you doing with, being in isolation and being in a very anxiety-producing time right now?
My addiction is pretty far in the past, so I'm feeling pretty good. And honestly, it's in some sense, it's isolation, but I do feel pretty connected to people, through Twitter, through the phone, through Zoom, through work. I feel really bad for people who are dependent on going to meetings. The in-person meetings, I remember early in recovery, were so important. And I'm just not that big a meeting person, but I think that's going to be really difficult for a lot of people in recovery from addiction. I personally haven't felt particularly isolated. If anything, you're in a small house with like a couple teenagers and your wife, it's, there isn't very much isolation. But I do think it's a really big risk factor for a lot of people. And I do miss my friends. And it's also just kind of weird because like you just hug your friends, they're just some people you work with that you're very close to. You see them, hey, you give them a hug, you talk, or you go out to coffee with them. So it is in some senses really isolating. But I feel like the isolation hasn't hit me in particular just because I tend to be very involved with a lot of people, both through my work and through all the other stuff that I do. So I feel like I'm hanging in there, but the stress is pretty rough. I feel fortunate that I'm not at the stage of life that I was in, say, 15 years ago, where when I'm stressed out back then, the first thing I would do would be to take a drug. The second thing I would do would be to take a different drug. And the third thing I would do would be to take a drug. Now that's not what I do. I exercise or I talk to someone or I go for a walk. So I feel like the stress is pretty monumental right now, but I feel like I've got much better coping strategies. So I'm doing okay with the stress, but it is pretty stressful, I have to say. And I'm, worried about people and doing my best just to be as supportive as I can to as many people as I can.
Yeah, it's a tough time. I think everybody's dealing with it in different ways, but I'm definitely really grateful as well that I have some of those kinds of things in my toolkit because as I don't know whether to say addict or former addict, but as somebody who has struggled with substance abuse in the past, this is definitely one of those incredibly stressful times where I would love to just have weed throughout the entire day. I have spent some days actually, honestly, just smoking to keep my stress levels down. But, there would be other times where I'd be drinking on top of it. So I'm really glad right now that I have meditation. I do a lot of yoga. I'm getting out and walking the dog a lot. So, I'm glad to have those sort of tools in my area as well. Even Mayor Marty Walsh was speaking about it the other day because he used to go to AA meetings. He said he still does go to AA meetings. And he was saying that he did his first one online the other day, and, it's not quite the same in person, but it's something, and it's definitely important to keep reaching out to people during this time.
No, absolutely. I'm, as a doctor, very much against smoking, but, at the meetings, everybody or a lot of people just like smoke at the break and hang out together. And, even if you're not smoking, it's just at the break, you hang out, you just chat, everybody catches up. Mm-hmm. And it's just not the same thing when you're doing a meeting by Zoom. You still connect with people and share information, but there's something about the warmth of being all together that's just not quite the same thing. And people are just going to have to adapt and make the best of it. And hopefully it'll be enough to sustain people and to get them through.
Yeah, hopefully it's not too long term and we can find our rhythm in a new normal. I want to talk as well about a couple different ways that cannabis is being linked to the coronavirus right now. I want to ask you first about your thoughts on the closure of the rec stores and what that really means to people.
Well, as a doctor, I have mixed feelings. I want everything on one hand to be closed just because we've got to flatten the curve. If we don't flatten the curve, this is going to be a spectacular disaster like they're having in New York. And I think we're making some progress, but we still have a long way to go. On the other hand, cannabis is clearly a critical, essential medication that millions of people in this country and tens, if not hundreds of thousands of people in the state rely upon. It keeps them off opiates. It keeps them off alcohol. It is essential for treating their insomnia, their chronic pain, their PTSD. So I completely agreed with the governor when he deemed medical dispensaries, cannabis dispensaries, essential. And I think it's a pretty arbitrary line oftentimes between medical and quote-unquote recreational and adult use. And I think it was a mistake to close the recreational dispensaries. I think a lot of medical patients get their medical marijuana from the recreational stores. And I think that it's important to keep them open. And if you close the recreational stores, then all of these patients that were getting their medical marijuana from the recreational stores now have another barrier. They have to go to a medical cannabis doctor and spend $200, $300, $400 to get a certificate, which, in most cases doesn't particularly add that much to their care because they already know how to use it because they've been using it. And then they have to go to a dispensary, whereas they've been, very successfully and safely going and getting cannabis and using it all along without any problems. So I think they should just keep the recreational stores open, consider that essential critical services, just like they did correctly for the medical dispensaries, and that would be the safest and most sensible thing to do.
I completely agree. I think if you close down the rec stores, that cuts off a lot of access for people. I also tweeted about it with my husband's permission to kind of open up the conversation because he's a veteran who goes to rec stores to get his supply of bud that really helps him with PTSD and sleep and anxiety. He was a medical patient, but when the time came to renew the medical license, we just weren't in a place financially that we could do it. So we were like, don't worry about it. There's a rec store right down the road. This was like back in January. And of course, come February, March sort of time, we're relying just on the rec side. And I start to, as somebody who's writing the news a lot, I'm like, I see these closures coming from far off. And I start to warn him that, maybe we need to start to stock up a little bit. And I just imagine like how many other veterans are doing this? How many other veterans didn't want to go to a medical marijuana doctor and they just wanted to buy rec, and now all the rec shops are closed and they don't have another option. I mean, you can always go to people in the illicit market, I guess, but you don't have the stuff that's tested. You don't know if it's like too high a THC percentage. That's the issue that we have. The reason that he was so comfortable going to the rec shops is because we could tell that it was tested at like a low, maybe like 11, 12% THC. Because anything too high is really unhelpful for him. And now we don't have access to that.
Well, thank you for being so open about that. That really helps people. I completely agree with you. And I think that your story perfectly illustrates this exact dilemma.
And the other thing is they're keeping open the liquor stores, and I'm like, why are you picking my poison for me, man? This is a stressful time. I'd like some access to some, well-tested bud, please.
Right. Well, a couple of things about that. One, they're keeping the liquor stores open because it's a more socially acceptable drug.
Mm-hmm.
So I think they're doing that. That's been very interesting. But it's also been very interesting that in almost all states, they have decided to keep at least the medical dispensaries open. And in many states, the recreational cannabis stores open too, which shows how far we've come in just in the last couple of years in terms of society's acceptance of cannabis as a critically important medicine. But the other point I wanted to add is that it is incredibly important to keep the liquor stores open, even in a different dimension than it is the cannabis stores, because so many people are addicted to and or dependent on alcohol. And keep in mind that alcohol is far more dangerous than cannabis, and that alcohol has a life-threatening withdrawal syndrome.
Right.
And if you were to close the alcohol stores, many people who are dependent and or addicted to alcohol would go into medically dangerous withdrawal and would end up in the emergency room. And that would clog up. First of all, it would be a disaster. Second of all, it would be dangerous. Third of all, it would cause all this unnecessary suffering. And fourth of all, it would tie up these urgently needed hospital beds, which are going to be clogged up, which we need for the COVID patients. Right. So you absolutely can't close the alcohol stores. I mean, I would have to say, and people would disagree, that it's even more important to keep the liquor stores open than the cannabis stores open, just because alcohol is so much more dangerous than cannabis, and alcohol has a life-threatening withdrawal, which cannabis doesn't, which is why cannabis is so much safer than alcohol. But if you were to close the liquor stores, you'd have thousands of people in the emergency room with seizures and delirium tremens. Think of what a disaster that would be.
Wow. The other thing I wanted to ask you about, which is sort of tied to that, inmates at the moment. Let's talk about inmates.
Ooh, rough topic.
Yeah, so I've seen you have been going off on Twitter about this one. But inmates of the war on drugs right now are probably some of the people that would be considered to be released during the outbreak because, inside a prison, inside a jail, it's like its own little petri dish. And to flatten a curve for the entire country is one thing, but to flatten curves inside each individual institution is going to be very difficult. So what do you think it looks like for the prospect of releasing, non-violent drug offenders at this point?
Well, this just kills me because these people shouldn't be in prison in the first place. And communal living is the most dangerous possible circumstance for coronavirus, which is why people are so worried about these elderly housing communities and why they dismissed all the colleges. And these people are captive audiences, and there's no way to socially isolate them in prison unless you put them in solitary confinement, which you can't do for everybody, and that would be cruel and inhumane anyways. Mm-hmm. And it's just so dangerous to have these people in prison, and there's no reason to keep them in prison if they're there for non-violent offenses. Obviously, if someone's like a homicidal murderer who's killed 40 people, society would have good reason to question the wisdom of releasing that person. But if someone is in there for outdated drug laws, they got caught selling marijuana 3 times, 3 strikes you're out, you're in there for 20 years. Why on earth would you keep them in prison to potentially die of coronavirus when you could release them? Of course, releasing them is a little bit complicated because it's not as simple as, okay, goodbye. I mean, they don't have a place to go. They don't have a home. They don't have a job. They don't have any resources. So, it's not just as simple as opening up the gate and sending them out because, you can't just set them free. They'll be homeless. And then we have a huge problem with homeless population. They don't have medications. They can't socially isolate. They're just outside suffering. Our society has no safety net compared to the European countries. It's just been so decimated by, I won't get in a soapbox about what decimated our, social safety net. So it's complicated releasing prisoners, but it's much better than keeping them in prison just to suffer catch